The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health education purposes only and complies with all HIPAA regulations. All of the CDC guidelines for COVID-19 safety were followed while filming this episode of the Dr. Fazil Show.
Good afternoon, and thank you for joining us for the Dr. Fazil Show, brought to you today by Health Tips Media. We're here today with Dr. Fazil to discuss some of the fake news, or not the fake news is what I should say, is because we've all heard so much fake news, and we're going to give it to you straight today, straight up, not the fake news. Thank you, Dr. Fazil.
Thank you, Wendy, and thank you, audience, for having me on this show. As Wendy said, the punchline or the topic of the discussion today is not the fake news. And now we all know in year 2020, we heard a lot about fake news and we heard about the fake news. So I thought it was time to come with something which is not fake. So we're going to talk about, generally speaking, since I'm a doctor, I'm not a politician. So I'm going to talk about the healthcare industry, fake news. So that's what the topic is today.
Thank you, Dr. Fazil. Dr. Fazil, in the media recently, we've heard a lot about the socialism involved with the healthcare industry. Can you elaborate a little bit on that for us?
Yeah, so that's a good question. As I said earlier, I'm not a politician, I'm a doctor. So one thing which we need to be worried about the most is, so people call it communism or socialism. So I'm going to focus on my expertise in the healthcare system. So today I'm going to talk about how the communist healthcare system is not the best system and could be really bad. I have a personal experience on that. My aunt, who was British, she died of a brain tumor, and what happened was that she was going to see her doctor for years and years and complaining of headaches, and she was given Tylenol for pain, and she was never sent to a specialist or had a brain scan or CAT scan or MRI, and eventually she died of a brain tumor which spread everywhere. So that was a real example from my own family member, where a socialist healthcare system killed her because they never done than could have been done or should have been done. So in USA, we don't have that healthcare system, and it's one of the best healthcare system, although people sometimes disagree with that. But the thing is, we talk about cost per patient, the care of cost per patient, and that's how we define the quality of the healthcare system. But at the end of the day, it's the life of the patient. It really matters and the quality of the care they get. So even the cost might be higher in the US-based healthcare system, it's just one of the best because they get diagnosed and they get treated appropriately. So this is a good healthcare system as compared to a lot of European healthcare system, which is actually a socialist health system as they practice in Europe or in Australia. And we hope we don't get that in USA, but I cannot predict the future at this time.
What's the difference between socialist healthcare and the United States healthcare system?
In the socialist healthcare system, generally it is, we can compare that to an HMO system in USA, where everything is controlled by insurance company. Let's say if I need to order an MRI or CAT scan, if you have an HMO, then I would need to call the insurance company, and somebody who's not even a doctor, have no idea about the patient. They will say yes or no, and it's your luck if you're gonna say yes or you're gonna hear no. So this is in USA. This is not very common. It's on case-by-case basis. Mostly they get approved for the appropriate test they need for making a right diagnosis. In the socialist healthcare system, um, it is like rather a norm. So the doctors, they don't even bother calling for hospitalization because they know it's going to be denied anyway. So generally they just do, I will call it TLC or tender loving care. That's all they get. So in one sense, they have all safety net and they have uh, health insurance, but that really doesn't do anything good to them, you know. So if you cannot diagnose anything early enough and treat them appropriately, then rather not have insurance. I mean, it's not a real insurance. So we don't have that problem in the USA yet, but I see a change in the winds. I see that we can see in one fashion, like hospitals are buying practices, and they're employing doctors, and when they employ the doctors don't have that much flexibility to do what need to be done, which is best for the patient. They do what's best for the hospital. So now we have seen that a lot of hospitals are nationwide buying doctors' practices, and once the doctors become employed, they have to be the yes man. They cannot be the prospect changes when their practice structure changes. So we need to be careful with the hospital-based care system, which is have a little flavor of a socialist medicine.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
So would you say that the hospitals are trying to maybe get control of a monopoly of the healthcare system?
Yes. So I think they're doing it for their survival, and you have to know how does the hospital operates. It's not that difficult. It's not a rocket science. It's not a rocket science. It's a very common knowledge, or it's easy to understand. Think about it. How does the hospital works? Hospital wants the hospital bed to be filled up. So that means that they want you to be sick. They want the ICU beds to be filled up. They want the floor beds to be filled up so they can generate revenue. And then, so the clinics they have, they're like the catchment areas. So you go to the hospital-based clinics and they end up admitting those patients to the hospital. So I have seen that they have low threshold on admitting those patients to the hospital beds, because it's the nature of the beast. So they have to do it because that's their whole business model. And I remember in the days when I was doing my moonlighting or training in one of the New York-based hospitals, I was a student back then, and I used to hear all the time the CEO of the hospital would call the emergency room physician, hey, you know, our hospital is empty, we need patients. And they will start admitting every other patient directly to the floor. And that is not what we're trying to do here, because obviously that will cause inappropriate admission to the hospital, and then it will increase the cost of the medical care, as well as we know hospitals are not the best place to be in when you don't need to be there. You can get superbugs, you can catch COVID-19 infection from the hospital-based systems, you can get something like known as C. diff infection, very common. And a lot of superbugs, they originate from the hospital because all the sick patients get into the hospital and then they transmit those infections. We have seen that doctors, they transmit that infection from one patient to another patient, not intentionally, but unintentionally. Even, for example, if they have a tie on them, that tie, when they bend over to examine the patient, that can touch the patient, and then they move to the next patient, and that infection gets transmitted through their ties to the second patient. So that's why there's something known as hospital-based or hospital-acquired pneumonia. That's a separate term. So the pneumonia you only get when you get into the hospital. So as I said, prevention is better than cure. So if we can prevent things in the primary care office, it's better for the patient, safer for the patient, as well as cheaper for the payers as well. So I think the future should be and would be primary care physician-based practices. But if the hospitals start to do things like what the communist societies have done in the past, then we will end up with the problem what they have, you know. So that's what I see, that we should stay away from that kind of healthcare system which is driven by the hospitals.
Thank you.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Dr. Fazil, can you explain the relationship between hospitals, hospice corporations, and mortuaries?
Yeah, so this is, I will call this like a love triangle. And again, they say follow the money, right? So the way the hospital get paid is based on their diagnosis code. Now, if you get admitted with pneumonia, the hospital get paid, for example, $3,000 for that diagnosis. If you get admitted for COVID-related infection, you might get $30,000, you know. So that's one thing. So you can see like why we're having so many COVID infections, you know. Somebody was joking the other day that, you know, if you get a gunshot wound to your skull, you get diagnosed with COVID infection. So that's kind of like, you know, it was a joke, but I think it's real in some cases too. That's why we're seeing so many cases of COVID-related infection in USA, because the reimbursement is so high if they get COVID-19 related diagnosis on their chart. And we know sometimes they false positive and sometimes they false negative. And sometimes if you get in the hospital by yourself, you might get admitted with something else, and you go to the hospital and now you get COVID infection there. And that's one thing. But again, the question you asked was, what is the link or a working relationship between hospices, hospitals, and mortuaries? So I would call it like an evil love triangle. So once the patient gets admitted, if they get discharged from the hospital, and if they get readmitted with the same diagnosis in 30 days, then the hospital wouldn't get paid for the readmission. That's the rule. So either they should do a very good job that you fix the patient and they stay healthy enough and don't come back. Or the other option is that, the hospices will take over and they say patient is too sick to be gone to home. And in the hospice, when you go to the hospice, generally they get paid heavily, but the patient have to, they generally have to have a life expectancy less than a month. So they get treated aggressively where they generally end up dying. And obviously if you're dead, you wouldn't be able to readmit. However, you might be able to vote, and we know that, which is a different story. Again, I said I was not a politician, so I'm not going to talk more about it. That's why we have fake news for that. So, and this is not a fake news. So, and then the next element in the equation comes is the mortuaries. So you go to the hospital. If you're lucky, you will come back. Hopefully, that's a common case. But if you are not that lucky, you will be in the class of the hospice. And once you're in the hospice, the only way they get paid if the patient dies within a certain period of time. So your chances of survival is very slim. And after the hospice, next assembly line or next person in the assembly line is the mortuaries. The next element in line is mortuaries, where you get taken care of, where you meet your maker. So not a good thing. Obviously, we live once and we want to live right and we want to do right things. So my goal is to keep the patient healthy, prevent preventable diseases, and if they get sick enough, try to do as much as we can do as an outpatient. That keep the cost low and also prevent hospital-based infections, which are very common. And also they can avoid being part of the food chain of hospice as well. So I would say a lot could be done as an outpatient with the modern technology, and we have modern technology in our clinics. So that's what it is. So hospitals, hospice, mortuaries, all in working as like an assembly.
Basically,
line.
one feeds the other.
Exactly, and that's the nature of the beast. Intentionally or unintentionally, that's how its system works. So don't be part of the system. That's what I tell my patients, and that's unfortunate. But that's in one way is how the system works, and that's why hospitals are scared now, and they're buying doctors' practices because they want to control. When you control, that is socialism in essence. So, and that's what I'm seeing, like nationwide, a trend where the hospitals, instead of increasing their quality, they're trying to do a monopoly by buying doctors' practice, so they don't have to increase their standard of care, but just to control the doctors, control the environment, control the media, and a lot of fake news.
So it becomes a quantity instead of a quality
Yes.
issue.
Yes. So this is my message for our audience today is to stay healthy and stay in touch with your primary care doctor, and don't become a statistic.
Well, what's that right here?
Here's what happened to the fake news. Got him. Got the fake news. Good.
Thank you. Thank you very much for joining us for our program this afternoon. We'll be back with you next month for some more not fake news.
Thank you, audience, for watching this show today, and stay safe and God bless.